your wellness journey. And here is how we approach our health. We want to balance and re-energize our body and life through habit change in mindset, nutrition, and fitness. Your ultimate transformation to a healthier, better life that you want and your body can only happen through a work in 3 pillars daily: having your right mindset, having your proper movement, and helping your body through nutrition as well. So if you need to learn more, please go to coachingbynadia.com, schedule time with me, or just browse the website and learn what it takes to achieve your ultimate transformation. And in fact, you can just start with baby steps, which is a free course under current programs, and start your journey if you're not sure where to start. It already seems overwhelming. Okay, so how to start exercise after surgery? This question I received a few times this last past week, and I feel it is important to open up the subject. And if you, again, I am a certified health, life, and fitness coach. I am not a doctor, neither physician. I do not cure, treat, diagnose any diseases, no treatments. It is a recommendation to look at your health, to look at your body from the perspective of actually physical trainer, okay? And so before I move forward, I want to ask you or someone you know who you're thinking about, who is actually experiencing this question or the struggle. How do I even get back into movement? Not even talking about exercise yet, just moving after the surgery. What do? I don't want to harm myself. I don't want to damage or go too fast or do something that is inappropriate for my body. And it hurts. Some things I cannot do. My mobility, flexibility is lost. I don't have that much balance anymore or now. So what are the struggles that the body is having after the surgery? Okay. So really the main message that I want for us to take into the heart. I know it hurts. I know it's hard, but the body needs to move. So here are the steps. I actually took a look at what will be the steps. How do I get back into regular exercises? How do I get back to movement daily? So there are, let's say, 4 steps that as a fitness trainer, as a health coach, I put forefront for the body, the physical body I'm talking about right now. So number 1, well, first of all, what is my overall? Let's look not just at immediate goal, but the overall goal. What kind of surgery did I have? And what is my long-term goal for the body when I'm talking about the exercise? Is it still weight loss, for example, and you just had a knee surgery or shoulder surgery? Do you still have a goal of weight loss as a long-term goal? Because that's really important when we start breaking down our exercise plan into chunks of time, let's say every 2 weeks or every month. It's really important what we want to achieve long-term. So what's your long-term goal? Number 2, in fact, what surgery was it? Now we are taking a look at our immediate actions that we want to place based on our short-term goal. What surgery was it? Because based on that, number 3 is really the question for the doctor or your physician. Are you clear to exercise? We're talking about exercise here. Are you clear to exercise? If yes, what are you allowed to do? In fact, before somebody comes in and they say, I just had a surgery in January, what can I do? My first question, are you clear to exercise? And my second question, again, I'm not a doctor. I want to hear from the doctor, what are you clear to do? And then we can build a plan. And The last one, so this was our, no, I think this was our second one. I'm looking at my notes. The third one is somewhat connected, depending, of course, what surgery you had. For example, shoulders. This is actually the highest injury among all other injuries. 80% of population have some kind of shoulder injury, whether it's just shoulder impingement, which just a pinched nerve, or you actually need something more on a bigger scale. After the surgery, it's really beneficial. I'm talking about general. It's sometimes so hard to pinpoint, but the main recommendation, start with the physical therapy. Physical therapy helps you to isolate the muscles that need to work on. It helps you to stabilize, mobilize the parts of the body that are needing attention. For example, if you had a shoulder surgery, most likely you're not going to work on your knee. And one of the biggest mistakes we do after surgery using the physical therapy, we finish too early. We stop, we quit before it's recommended. We really need to go through entire recommended time frame, because it's really crucially important to retrain our body, our nervous system to move appropriately. When we finish too early, we don't allow our central nervous system to kick in and retrain the muscles, joints to move appropriately. Therefore, for example, if I had shoulder surgery, I went through a physical therapy or not, or I stopped too soon, the central nervous system starts receiving improper impulses. I'm trying to find the words that will be more easy to understood. Improper impulses, and the feedback from my central nervous system becomes movement compensations. So if you can see, I started moving my shoulders forward. It's a movement compensation followed by neck forward, head forward. Of course, everyone has something different, but this would be often be seen. Movement compensation leads to potential injury again. So it's really important through proper practice, and practice means with an experienced physical therapist, fitness trainer who knows what to do. I got a corrective exercise specialization to exercise where you include your feedback into the exercise, helping your body with internal feedback. How am I feeling? What's the sensations? External feedback. When the trainer, physical therapist is helping you through the form, through the knowledge and of the results and the knowledge of feedback, through showing the form. Form is so important because in the form we practice the right proprioception that helps our central nervous system to receive the signal how to do it correctly. And that practice and experience leads to the change that becomes a permanent change. In fact, it becomes a habit. We are retraining our body to remember how to do it appropriately. And if we don't, we finish too soon, we give up, or we don't do it at all, or we finished physical therapy and don't do anything else afterwards. We haven't given our central nervous system enough time to teach our body back how to function properly. Okay. I hope I didn't say too much into it, but it's really so important to understand. What we see a lot is chunks and segments of exercises and not really seeing the bigger picture. If I had a surgery, I need to take time to recover, have doctor's visits, be cleared to exercise, continue with my physical therapy, complete, practice as is recommended, and continue with my physical movement with exercise. Us as fitness trainers, well, of course, it depends what fitness trainer you're talking to. With my knowledge, I can pick up where you are or have been at the physical therapy treatment, and we can continue that with the helping your entire body with integrated exercises, integrated movements. So the general recommendation, again, we're not doctors, it's really individual. If you hear something that you disagree, that will be an individual conversation. Everybody's different, every case is different. The general recommendation, as I mentioned, after the surgery, recovery, clear to exercise or go to physical therapy, go through entire stage, entire program at the physical therapy. Somewhere around that time, you probably will be able to walk, maybe have gentle stretching, nothing big. If it's recommended, it may not. But the important thing, especially when it hurts and I can't, but I already was told that I need to, is not to be still. The body needs to move, the blood flow needs to go, the central nervous system is hungry to start learning and relearning how to move appropriately. And second step, as I mentioned, general stretching. In fact, if you would like, I believe I recorded a couple of stretches that you can take on after you talk with me. And we want to make sure that those stretches are good for you. All surgeries are different. The body needs different things. And number 3 is physical training. As I mentioned, you actually start physical training at the fitness therapist office. And they will probably work on particular need that your body has. For example, if you had a shoulder injury. With that, after you graduate or maybe throughout the physical therapy, I want you to consider to engage your entire body. We want to help central nervous system for all the muscles to interact. So it's not just interaction inside one muscle group, but it's interaction between all the muscle groups to help your body, full body strength, full body balance, and really integrated coordination among all the muscles. So for physical exercise, I want to start with balance, simple, easy balance exercise, and build my stamina, build my core. Then I will continue with gentle strengthening, maybe even isolated strengthening where I work on one muscle at the time, just to teach those muscles to do what they need to be doing. And then gently I start including the integrated strengthening. That's where I include several muscle groups where they need to communicate among each other what to do. For example, I touch my knee and I lift my arm overhead. There is a lot of motion going on. Several muscle groups are needing to talk. And what we actually do throughout this whole entire process is, again, we are teaching our nervous system to receive the right signals, how to move, to retrain our muscles to move appropriately. Proper form helps your body learn long term and build that habit back how to move the right way. Prevent injuries, feeling stronger, feeling we've got the stamina again, that we can do the house repairs, go for a walk, go for a hike, and be back in our balanced body and balanced life. All right, well, folks, I know this was quite an interesting conversation, maybe something unusual, but I felt I wanted to address this topic, how to exercise after the surgery. And please, please, please understand, this is a very general recommendation. If you feel this is something you heard may not be for you, but you really want to take a deeper look, what it is for my body that I need to be doing for the exercise, please schedule time with me through coachesbyNadi.com/contact. Find the option that is suitable for you, whether we just talk for 10, 15 minutes, or you want to dive into your full entire Getting Started Discover session. It's all into that page, coachingbynadia.com/contact. And if you know someone who is really struggling, just share this video with them. Let them hear, and then it's really up to us how we move forward. Before you go, if you heard something that you would like to express, maybe aha's appreciation from this conversation, maybe you know someone, you can also tag them under the video if you feel appropriate. Thank you for listening. Please remember to help your body help you to balance and re-energize your body and life. Thank you for listening, and I will see you in the community really soon.